Diabetes has become Australia's leading burden of disease. Western Sydney has twice the rate of diabetes as the Seaside or other suburbs. And this is driven by the social determinants of lower income, less physical activity and more car driving, and less availability of healthy food. And also the cultural mix of people coming from Asia, Middle East, Pacific Islands, and a high Aboriginal population. The Western Sydney Diabetes aim is to take the heat out of our diabetes hotspot. It is led by Western Sydney Local Health District, Western Sydney Primary Healthcare Network, Diabetes New South Wales, and PricewaterhouseCoopers. It has an alliance of over 100 members who are actively working together.
Between us and our neighbouring districts, we can reach 25% of the population of New South Wales if we just think differently and think better about how we do it.
As a member-based organisation, our key role really is consumer engagement. So we're not medical experts, we're not health professionals necessarily, but we can engage with all levels of government, we can represent the rights of people, and we can represent things that are politically sensitive in terms of the way areas are built out, what transport's available, what parks are available, what sort of food locations and sorts of food are available. And so we play a large role really in representing those politically sensitive issues that other parts of the initiative are unable to do.
Our key role as a key partner in Western Sydney Diabetes is to integrate the work of the acute sector, the hospital sector, and the specialists that work within that with primary care, general practice, and the allied health professionals that work in that sector. So the Australian health sector doesn't necessarily work together particularly well. The various parts are funded differently, and what that means is often there is a misalignment with client care and patient care. The PHN in our role is to try and bring that together, to integrate those varying parts.
We have developed a framework of action which includes primary prevention, and this includes increasing the healthy food supply, increasing physical activity, and improving the healthy built environment with government leading the way. The second part of the framework is secondary prevention and management, which goes all the way from early detection of diabetes, building the capacity of the general practice in the community to better manage diabetes, better self-management of diabetes, and more integrated care with the acute hospital system.
Our supports include a GP hotline, which allows the primary care physicians ready access to an endocrinologist and a specialist within the hospital sector. We also have specialist case conferencing, which allows a team from within the acute sector, so specialists, to go out into general practice and upskill them and allow them to manage their patients.
So this team comprises of the patient, the GP, the endocrinologist from the hospital, along with a diabetes educator, and we do like a 30-minute consult. And it's been extremely successful. So this is an excellent example of a patient-centered management where we exchange information about the patient and the patient has an input as well. And we found that the patients really like this. The Western Sydney Diabetes app is an app that allows the patient to have some control of their management of the diabetes. So it looks into diet, in exercise, blood glucose monitoring, medication intake. So it's basically centered around the patient. It is created by the patient and the doctor. It's very patient-centered.
I was diagnosed in 2001. Why was it me that had it? Because I really didn't know anything about diabetes. I had barbaric sleeve surgery, lost weight, and from there it just got better and better, and all my functions in my body just come back to normal. The people that have helped me, and Professor Mabley and Dr. Shantini and Dr. Bichet, how they've all helped me, and I owe that to them. And in my heart, I'll be always thankful.
We have developed a model of care and demonstrated that it really works. However, we are not at a scale yet large enough to address the size of the problem. We need a larger investment from governments and our partners to address diabetes in Western Sydney, to take the heat out of our hotspot so we can beat diabetes together.